Bonjour tout le monde. Hello, everyone. Welcome to today's session on National Standards for Healthcare Equity, the case for Provincial Interpretation Services. In today's session, we will be sharing an exciting update from the N4 National Newcomer Navigation Network Community of Practice Working Group on access to interpretation services. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah Maddock, and I'm a project coordinator with N4. I will be hosting today's webinar. My co-host is Andrew Tomeyer, and Andrew will be monitoring the question and answer box today. And I'm very pleased today to introduce to you today's webinar speakers. Our first speaker wasn't able to be here live, but we did pre-record him, and he will provide an intro to today's webinar, and that is Dr. Timothy Holland, who is a physician at the Newcomer Health Clinic in Halifax, Nova Scotia. And Dr. Holland also provided leadership to the N4 COP working group. And our next webinar speaker is here with us live, and that is Miss Alana Carlisle, who is a manager at Language Access Shared Health in Winnipeg, Manitoba. And Alana also served as the N4 COP working group co-lead alongside Dr. Tim Holland. And our next speaker is Michelle Quinlan, who is a quality improvement specialist on the N4 team. And Michelle provided lots of support and guidance to the N4 COP working group. And also not able to join live today, but who the next person and speaker who played a significant role in this work was Miss Kat Goodfellow, who is a research coordinator on the N4 project team and who provided significant support to this work that has been done. So access to professional healthcare interpretation is a serious health equity issue. Without the ability to communicate with a care provider in the preferred language, patients cannot engage with healthcare services, and the legislative obligations under which healthcare providers function cannot be met. So today's webinar will provide an overview and an update on the work that the N4 Community of Practice completed recently. And our session today is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. And should there be any technical issues during the webinar, we will inform you with details for an alternate makeup session. And before we begin today's event, I would like to take a moment to introduce you to our platform features. Throughout today's session, we invite you to write your questions using the question and answer window. And we know that sometimes some of you might have the same question or be interested in a particular response. So you do have the option of upvoting questions today. We have also enabled a poll today that we will launch later on in the presentation. And towards the end of the presentation, we will enable the chat for a brief facilitated activity that Michelle is going to lead us through. And our speakers today have no conflicts of interest to declare. And with that said, let's jump right into today's webinar, which begins with a pre-recorded introduction from Dr. Tim Holland.
Thanks so much. And thanks to everyone for coming out and providing us with the opportunity to provide this update on our position paper, the National Standards for Healthcare Equity, the case for Provincial Interpretation Services. So first off, I'll be presenting the process behind the creation of the position paper, and then I'll hand over to Alana, who will share more about the content of the paper itself. So to get started, I'd just like to also provide a high-level overview of the community of practice, or COP, as we often say, and the model that we use in forming our workgroup deliverables. The N4 COP, the model is governed by the COP Steering Committee, and as you'll see here on the slide, this is the Community of Practice Steering Committee. It's chaired by myself and Jean McRae, you can see there. We meet quarterly, we have our terms of reference that we follow, and we provide guidance and strategic oversight for the working groups. And so the COP Steering Committee is, of course, assisted by the fabulous N4 team, and they help guide membership efforts and help with the corresponding working group projects. So the COP structure itself includes these time-limited working groups that have the goal of producing evidence-based, outcome-driven, and impact-focused deliverables to address the root causes of inequities for newcomers in accessing health, social, and settlement services. And so the COP Steering Committee ensures that the working groups have the support they need to advance that work. Now, right in front of you, you'll see a slide that shows our overall timeline. I'm going to focus mostly from the June, September spot onwards. And so in partnership with the COP Steering Committee, there was a survey that N4 developed in the summer of 2021, which asked for which issues our working groups should focus on, which were planned to launch in the fall. And after this survey, COP Steering Committee members were presented with the top 5 issues that the poll had revealed. And out of that, we kind of did this kind of live action, like impact valuing and feasibility, all these sorts of fun little metrics that we put together to come up with what we felt were the 2 most appropriate working group topics. And so those are going to be access to interpretation services, which I co-chaired, as well as alongside the steering committee as well, and the Afghan refugee resettlement toolkit. So these 2 working groups were launched in October, and there have been 4 monthly meetings since then, between October and March, spread out a little bit around the holidays. And the deliverables from those working groups are now complete. And that kind of brings us to the presentations to these webinars that we're doing currently. So going to the access to interpretation working group. As I mentioned, I co-chaired this with Alana, who's going to be speaking in a moment. And we were set with the deliverable to establish a position paper or guideline for interpretation, which can be implemented nationally to ensure equitable access and experiences with health and social services. And so our working group itself, it had professionals who worked in all sorts of different sectors, health, settlement, social services, but all of it worked with newcomers. And we work together to identify barriers and find solutions to support equity for newcomers. Our working group aimed to be a space for members to connect with their peers, and both cross-sectoral peers and within sector peers. And we would work collaboratively and focused on the project in the field of this newcomer support. Now, the nice thing is when we were signing up for these working groups, all members knew that the involvement in the working group would be short and time-limited commitment. We said there's going to be 4 monthly meetings. They're going to be about 1.5 hours to 2 hours. So you kind of had a good understanding of what it was you were getting involved in. Of course, there was opportunity to get more involved if you wish, but you kind of understood exactly what the commitment was and what the timeline was going to look like. And so the N4 team was very supportive. They created the project charter for the group. They helped develop our work plan. They conducted the research. They organized and supported the working group meetings themselves and the corresponding subgroup working meetings, and completing the working group summary documents. So just absolutely the great team to work with on this project. So here you'll see, this is a slide that shows the working group membership. As you can see, the 18 members of the working group covered considerable cross-sectoral range and also geographic range. And so it was just a wonderful group to work with. And so a huge thanks to each and every member of the working group. It was just a fantastic group. You just hear so much interesting perspectives, someone from education giving an insight, how I hadn't considered that angle, or that someone from settlement giving something else I hadn't considered. It was just a fantastic group to work with, and just huge thanks, like I say, to each and every member of this group. It was a great team to work with. And then this is shows our milestones there. And so as you can see, these were the milestones that the working group aimed to cover. You've got at the end of January, our goal was to look at finish the environmental scan and to curate the existing research on and position papers on the costs and benefits of providing interpretation services. Then into February and early March, try to develop clear evidence-based recommendations on provincial coverage and interpretation for health and social services. And then into mid-March, developing the communication strategy dissemination of the position paper guidelines, which was really critical. Nice thing is we went through this. While these are the key milestones, throughout the whole project, these things are kind of running in parallel. And so always the N4 team was sort of keeping us on task, but also understanding the end goal. Like, we're not just developing a document, we're developing a document that we want to do something. We don't want it to just sit on a shelf somewhere and collect dust. And so we were always mindful of how the dissemination strategy was going to be and what the impact was we were aiming for. And so, I mean, it's just been a real privilege to co-chair the working group and that produce this document. And I really must express my appreciation for the N4 team for both gathering together this great working group people, but also just the incredible support that the N4 brings to this, because it's a lot of these projects, stuff like this, it's always like we always want to be doing some sort of advocacy work, developing a document that can help push forward access to interpretation. But I'm a family doctor on a really busy refugee clinic. I don't have time, and everyone in Selman's always kind of trying to find time. And so this was a great opportunity for us to come together. And N4 was able to do a lot of the logistical support, the heavy lifting that we can't find time to, but we're still able to contribute our perspective, our expertise into the project itself. And so I think that was just a great partnership between the working group and the N4 team to be able to produce this document. And so just huge thanks to the N4 team, and also allowing people to be able to, like I say, engage in a time limited fashion they know is feasible. But if you wanted to do more, you could end up joining the subgroup that would, dive into the actual like drafting of the document and crafting of the recommendations. So it was a great working group to participate in, and there'll be more to come. So if you're out there and you're interested, just keep an eye out for as those working groups come forward from N4. So at this point, the position paper is complete, and it is available on the N4 platform. And so I'm going to pass it on to my colleague, Alana, to share more about the position paper itself, the content of the document.
Wonderful. So after that thorough introduction from Tim, I'm very pleased to be able to take some time now to look at the content of this position paper itself. So, before we even launch into the paper specifically, it would be helpful to set the stage by really acknowledging that this work is already building upon overwhelming international evidence that exists that demonstrates the risks associated with language barriers and the risks in working with untrained interpreters, in particular in a healthcare setting. So we know that there's evidence out there that exists that shows that when we have a language barrier or perhaps an untrained interpreter, we have some of the outcomes that we see here on this slide. So we have decreased access to care, higher chances of misdiagnosis or errors, higher number of critical incidents, unfortunately, in the healthcare system, decreased satisfaction from all parties, and also, interestingly enough, an increase in healthcare costs. We know within the health system that when we can't communicate effectively with our patients or clients, service providers are inclined to have more repeat appointments, to order more tests so that they can try and figure out what is going on. So we already have this in place when the N4 working group began work on this particular paper. Now, moving to the next slide, please, Mariah. I also want to address the fact that we know that there is also overwhelming evidence that supports the benefits in working with trained professional interpreters. So this evidence and research demonstrates for us that a professional interpreter can help build better relationships between patients and clients. We have enhanced confidentiality, satisfaction. Ultimately, it's supporting better accessibility and equity in the care that's being provided. There's also more specific pieces like support for informed consent, right? We're probably not obtaining informed consent effectively if we're not communicating with patients and clients. It also leads to more appropriate utilization of healthcare services. So again, all the members of the working group who came together to work on this paper had some of this knowledge and background in mind when this work began. So it's interesting to be thinking about this as we proceed with our conversation today. Now, looking at the next slide, we wanted to start this conversation by engaging you a little bit in a scenario and getting some feedback. So we will be launching a poll based on this scenario. So I just want to read this out for everyone, and then we will be seeking your opinion. So essentially, we want to hear from you. So imagine for a moment that you are a healthcare provider who is going to be meeting with an elderly patient to discuss treatment options. The patient's adult child has come along to act as an interpreter for the appointment. Now, over the course of the discussion, it becomes clear that the child, the adult child, is speaking on behalf of their parent, and your patient is not at all engaged in the actual discussion. So you begin to question the accuracy and completeness of the interpretation that this family member is providing. So you decide to schedule a follow-up appointment and arrange an alternate solution for interpretation. So now we're going to put the poll up, and I would like you to answer the poll based on the real life resources that you have in your area to access. So think about what you have at your disposal in your particular region in Canada when you are acting as this imaginary healthcare provider. So what would you do in this situation at the follow-up appointment? Would you use Google Translate or another translation app to help support interpretation because that's all you have? Would you ask the patient to bring another friend or family member to interpret? Would you ask a bilingual colleague to interpret at that follow-up appointment? Would you access a telephone interpreter through a phone line? Or do you have access to professional interpreter services face-to-face who can help you? So please take a moment to answer that poll, and I'm interested to see the results, to get a sense of who is at the table here with us today and what kind of access to interpreter services you have in your area. And Mariah, I trust you will share the results when everything is in. Here we go. I hope everyone can see that. So this is fantastic. I see that there are very, very few people who would rely on a Google Translate or another app or ask a friend or family member to interpret. Also very few who would ask a bilingual colleague. So this tells me that those of you who are here already have some knowledge about these risks associated with untrained interpreters that we were speaking about earlier. So I'm very pleased to see that we have, let's see, 32% would access an interpreter through a telephone line. So you have access to that in your region. Excellent. And 42% actually would arrange a professional interpreter. So this is wonderful. So this tells me that those of you who are here today do have some resources at your disposal to access professional interpretation, which is such good news. And ultimately, I'm hoping that we'll be able to leverage that and the expertise that you're all bringing with your experience working with trained interpreters to share and disseminate this position paper that we're talking about today, so we can work towards supporting other areas in getting this same access to professional interpretation, because we know ultimately how important it truly is. Thank you, Mariah, for that. Let's move to the next slide, please, and proudly introduce our position paper. So this gorgeous paper that we're very proud of as a result of the hard work of the working group, the community practice working group. Now, I just want to acknowledge on behalf of N4 that N4 would like to thank the Access to Interpretation Working Group members and the Community of Practice Steering Committee for their participation in this work. The tireless commitment to ensuring that this position paper was evidence-based and outcome-focused, in particular during a global pandemic, was instrumental and really greatly appreciated by the N4 team. Now, a full list of the champions of equity can be found at the end of this document, and were also listed in a previous slide by my co-lead, Tim. Now, N4's infrastructure, which supported this work, would not be possible without the support of their funder, Immigration, Refugee, and Citizenship Canada, IRCC. So in addition to reading that acknowledgement on behalf of N4, I need to turn that around for a moment and echo some of Tim's thoughts that none of this work could have been possible without the support of the N4 project team. They were truly instrumental in supporting this work and moving us along. So this has just been such a true shining example of collaboration and partnership. So thank you for that. So this position paper was shared along with the information about this webinar. So I'm hoping that many of you here today already have a copy of the position paper and maybe have had a chance to read through it. I'm hoping that maybe someone from the N4 project team with us today may also be able to post a link to the paper in the chat at some point so that folks can access it and follow along. I welcome you, if you have the paper at your disposal right now, to open it and follow through with us as we discuss various aspects. So the first step in introducing this paper is to share its objective. So our goal ultimately was to really be able to enhance the reader's understanding of why access to professional healthcare interpretation is a matter of equity, accessibility, and safety, and how this information can be actioned on many different levels. So to talk specifically about this piece, I would like to welcome Michelle from the N4 project team to introduce the scope of this paper. Thanks, Michelle.
Thanks very much, Alana. So a note on the scope of the paper. This paper focuses on health equity and specifically the imperative to fund professional healthcare interpretation at the provincial level across Canada. Early on in our work group meetings, it was decided that this national focus was something that N4 could take on. If you're attending today's webinar as a provider, and you're looking for more information or guidance on working with interpreters, or you're thinking about policy or guidance for your organization or health region, we've selected some high quality resources and added them to the scope section of the paper. And I'll just take note that my colleague Andrew has posted a link to the position paper in the chat. Thanks, Andrew. N4 is an intersectoral network for healthcare and settlement providers. And so in this paper, we do address the points of contact between healthcare and settlement. Our understanding from our network was that providers working in these fields feel quite siloed. As we began this work, we had many stimulating conversations about referral pathways, professional boundaries, and bilingual service providers. It became clear that as a network focused on immigrant and refugee newcomer experiences, the voices of settlement professionals were an important inclusion. And finally, a final note on the scope of the paper. Although we focus on immigrant and refugee newcomers, it's important to note that the research in this paper can be used to support the case for interpretation for people who speak one of the many Indigenous languages of Canada, or who use a signed or tactile language. The recommendations put forward in this work can close multiple health equity gaps for patients whose preferred languages are not spoken or signed in their healthcare environment.
Thanks very much for that, Michelle. So what we're going to do is take a look very high level at some of the different sections of this paper. We can see that the research section begins with a policy review and then moves into some different key areas of research which support the need for access to trained professional interpreters in healthcare. So we will review some of these different sections and then provide an overview on the key elements. So looking at the next slide, looks for a moment at section 5.1, which is the policy review. So in reading through the paper, which many of you probably have already done, we learn here that policies addressing access to healthcare are often uncoordinated across different sectors. Despite that, however, evidence around the social determinants of health demonstrate how closely tied influences such as education, safety, housing, social and legal services have on health outcomes. So we also know that language barriers may limit access to these social services, resulting in further health inequity. Now, of particular note, it's interesting, and it's pointed out in this section of the paper, it's interesting to see how integration of interpretation is already present in legal systems and supported by the Canadian Charter of Rights and Freedoms. And what we have up here quoted on this slide is section 14 of that charter, which states that a party or a witness in any proceedings who do not understand or speak the language in which the proceedings are conducted, or who is deaf, has the right to the assistance of an interpreter. So this we just pull out as an interesting point because this really is in contrast to the health system, where limited or non-English or French speakers are often being asked to bring their own interpreter or to find a friend or family member who can assist with interpretation, which results in further burden on families and patients in the system. Looking at the next slide, we move into section 5.2 of the paper, which really looks at the role of the professional interpreter in a healthcare setting. So we're first introduced to some of the ethical reasoning behind working with trained professional interpreters. So again, we know this from the evidence that we talked about earlier today. We know that untrained interpreters, from an ethical standpoint, may not have an awareness or understanding about ethical principles such as accuracy, confidentiality, or impartiality, right? Someone who's not trained in these areas may come to act as an interpreter at an appointment and then go back to the community and share information that they learned. They may potentially have a vested interest in the outcome of an appointment and may choose to change the message, to omit or to add information to suit their purposes, simply because they are not aware of that ethical principle of impartiality, which is taught to professional interpreters. So when we look at that notion of the ethics behind why interpreters support quality healthcare, we have those particular pieces. Also an acknowledgement of the fact that friends, family members, in particular children, should not be asked to interpret, especially in high stake settings such as a healthcare environment. Moving over to patient safety, this also was addressed in the paper, and we know it's clear that when healthcare providers cannot communicate with their patients or clients, the patient is not safe and neither is the provider. So ultimately, professional interpreters support that process of informed consent, enhance a patient's engagement and participation with their treatment. I can share from my own personal experience, just anecdotally, a story here with this particular point, because I think it highlights how important this patient safety piece is. So I have the privilege of managing the Provincial Interpreter Services in the healthcare system in Manitoba. And so I have the benefit of hearing many success stories and challenges from interpreters and service providers all across our province. Now, a little while ago, I heard a story from an interpreter here in Manitoba who shared with me that she had been scheduled to interpret for a patient who was having an appendectomy. So she was there with him for his pre-op appointment to prepare for the surgery. Now, this was the first time the patient had a professional interpreter at one of his appointments. He had been seen previously by his care providers, but had not had, no one had requested a trained interpreter for him. So interestingly enough, during that initial conversation with the professional interpreter present, it came out in the conversation between the physician and the patient that this individual had already had the same procedure done prior to coming to Canada, and there was no need for this surgery. And what was shocking for all the parties involved was what the consequence could have been if that had not been accurately communicated with the support of that professional interpreter present. So when we think about patient safety, that story is just scraping the surface, I think, at some of the risks that can occur when we don't have professional interpretation present within a healthcare setting. Now, this section of the position paper also looks at quality of care. So when we're reading the paper here in this area, we learn that evidence shows that limited or non-English speaking or French speaking patients in Canada do receive lower quality of care than their English speaking counterparts. And this comes as a result of decreased access, decreased satisfaction, poor understanding of instructions and medications, which ultimately results in longer hospital stays and increased risk of medical errors. Again, speaking very personally from my own experience here in Manitoba, I have observed that patient satisfaction, being a pillar of quality and quality improvement, is often overlooked with limited or non-English speaking patients because the language barrier prevents patients from providing feedback and prevents them from being active participants in their healthcare experience. Looking now to the next slide, this is going to prompt us to move into the next section of the paper, which discusses the need to ensure uptake of professional interpretation. Now, we know that there are some key elements that might create barriers to accessing professional interpretation, even when it is available in a particular region. And some of those barriers may include things like cost, challenges with administrative challenges, and also service provider training and awareness. So looking for a moment at the cost piece, right? Cost, or the perception of cost, may create a barrier to providers accessing professional interpreter services, even when they are available. However, evidence suggests that the upfront cost of interpretation ultimately results in better utilization of services and cost savings. So there's actually a story that was inserted in the position paper that was provided by one of the working group members. And just to share a quote here from the paper, it states that one hospital uses an automated system to inform patients about preoperative fasting guidelines. This system is presented in English and French. Patients who cannot understand either language sometimes arrive to their surgery without having followed the guidelines. When this is caught, the surgery must be rebooked, which wastes time and resources and creates additional stress on the patient. So again, just another example how professional interpretation can really enhance better utilization of services. And this that I just read out loud is an example of what we can encounter when we do not have professional interpreter present. However, we sometimes think that paying for an interpreter is really a detriment. We see here that it can actually lower the impact of cost to the healthcare system. Now, administrative challenges, such as complex interpreter booking procedures and processes, can also become a deterrent or a barrier to service providers choosing to access professional interpreter services. So within the paper here, it is suggested that a centralized booking process can save time and reduce this frustration for service providers. So we have some models of this in various places in Canada where provincial services are coordinated in one central access point. So it would be very interesting to learn from those experiences as a springboard on how that can be improved more consistently across the country. Now, provider training, healthcare provider training is also key to supporting access to professional interpretation. Some providers may not be aware of the risks associated with language barriers and the benefits of working with trained interpreters. They may not understand the role of the professional interpreter and how to work effectively with professional interpreters. So that support for healthcare providers is really important, right? We have to make sure healthcare providers don't think that they can just raise their voice or wave their arms around and that's effective communication. They need that buy-in to understand the difference it makes to have that professional interpreter present. Now looking at the next slide, thanks Mariah. I'm really pleased to share that within this position paper, we have a very unique section which includes settlement experiences with healthcare interpretation. So as we know, the settlement and healthcare sectors are very, very closely linked, but are often not considered together in policy development or research. So this section not only stands out, I think, in the position paper, but was actually also a unique aspect of the diverse intersectoral working group that N4 hosted that supported the development of this position paper itself. So just to backtrack for a little moment, we know from the N4 needs assessment that was done in 2019 that it is an asset for settlement workers to speak the language of clients they serve. And it was also reported at that time from those working in the settlement sector that settlement workers are often called upon to interpret in different settings throughout the course of their work, including healthcare settings. So keeping this in mind, alongside of this, however, there's also a recognition by settlement providers that settlement workers and ad hoc interpreters are not always able to facilitate professional interpretation where that specialized terminology or knowledge is required, such as in a complex healthcare or perhaps legal matter. So this lack of access to professional healthcare interpretation ultimately results in this inappropriate burden being placed on settlement workers to fill in the gaps. So by enhancing access to professional interpretation in healthcare, while also educating service providers and settlement workers on the role of the healthcare interpreter, we can really empower and support settlement workers to identify when it is safe and appropriate for them to provide language support and when a professional interpreter is really required and beneficial. So just to share another quote from the paper here, it was written right in there that settlement and education workers can work productively with healthcare providers to identify cases where specialized healthcare interpretation is required. Professional boundaries for settlement workers can be upheld with the assistance of healthcare workers, leading to better and more empowering experiences for newcomers. So I love that piece in the paper. I think it's really unique and stands out for us. So looking now to the recommendations, right? This is really the goal of this paper, to make recommendations on different administrative levels and at different levels of government on how we can move forward to have more equitable access to professional interpretation across Canada. So in the paper, you'll note that these recommendations are divided into the federal, provincial, and then more local levels. So here the recommendation at the federal level is to develop and implement national standards for professional interpreters. So those of you who are already active in this work and in the industry know that there is a national standard guide for community interpreting services that was published back in 2007 by the Healthcare Interpretation Network, which has now joined the Ontario Council of Community Interpreting. So this guide addresses the competency, the role, and the responsibilities of professional community interpreters, including those working in healthcare settings. Now, although these guidelines have existed for many years, there has been no coordinated support at the government level for them to be consistently implemented across Canada. So this support really is required at that federal level to ensure that equitable, consistent quality of care and access to interpretation in the Canadian healthcare system. Looking at the next slide, we move now to the provincial level of recommendations. So here, the working group that produced this paper has suggested that it's important to establish funding models for professional interpretation to support healthcare organizations. It's also been recommended that legislation be created and policies to ensure the use of professional interpretation in healthcare. Another point was to establish access to professional interpretation on a cost recovery basis for non-health related sites, programs, and services. So for example, in the health and social, outside in the social service sector, pardon me. So, this is a very interesting concept as well, because we know that when clients come into the health system and require the support of a professional interpreter, chances are they will also need that interpreter support in other areas of social services that they are accessing. So just again to speak, very personally from my own experience here in Manitoba, we are very privileged to have funding from our provincial health authorities to offer professional interpreter services within the health setting. And we've actually done exactly what's recommended here in this third bullet point. The services of the language access interpreter team in Manitoba are available on a cost recovery basis to the Manitoba Department of Justice, Department of Families, all the social services programs, as well as other independent agencies and organizations. And we've really seen the benefit of how the interpreter service can follow these clients no matter where they are in their journey, acknowledging, as I said before, that some of these services really are also social determinants of health. And so being able to wrap around the client and address all of their needs is something that's really important. Now, looking at the regional or systems level in terms of recommendations, it has been recommended in this paper that formal policies, procedures, and practices should be established regarding access to interpretation as a key component of health equity for newcomers, including professional development and communication strategies to support implementation. Now, again, because I can speak specifically from my experience in Manitoba, something that we found has been successful here to support the work of our team in promoting professional interpretation is the fact that all health regions in Manitoba have implemented an interpreter services policy that specifically states when healthcare providers must request the services of a trained interpreter and how to do so. It also goes on to state specifically that ad hoc interpreters, in particular children, should not be asked to interpret. So something like that has been really beneficial for my team to be able to use as a tool to educate service providers when there might be some hesitancy or lack of understanding as to why this engaging a professional interpreter is important. So being able to leverage some of that work and guide this as a consistent approach across all provinces is certainly a recommendation from the working group. Another point here is to promote equitable hiring by seeing non-official languages as an asset. And so really being able to provide a direct service in a patient or client's language is also highly beneficial and ultimately doesn't require the access to a trained interpreter because we can provide that service directly in the patient's language, then relying on professional interpretation when that is not possible. So looking at the next slide, thanks, Mariah. Just further recommendations at the regional or systems level, it's been suggested that we need to create policies that recognize health interpretation as a medically necessary service, respecting minority language rights for residents not proficient in the official language. Also, the consideration should be made for training international medical graduates living in Canada, but who are not working in their field of study, to support them in working as professional interpreters in a healthcare setting. And that's something, again, in our experience in Manitoba with our services, we often see that many of our interpreters are highly trained, very, very skilled, foreign trained professionals. And this sometimes acts as their first opportunity for work in Canada while they continue to learn more about the healthcare system and perhaps launch them on their journey to becoming qualified for other work. But they bring that asset of their knowledge and training and are hugely skilled and huge assets to the interpretation team. So now that we've had the chance to review some of the content of this paper, I'm pleased to be able to turn it back over once again to Michelle from the N4 project team to discuss the next steps related to this work.
Well, thanks so much, Alana. I just wanted to echo your kind comments earlier. For me as well, it's been an absolute pleasure to work with you and Kat, Tim, and the rest of the valued working group members on the creation of this important position paper. And so it's time to reflect on what's next. As a working group, we collaboratively developed a communication strategy, dissemination strategy for this position paper. And here at N4, we are committed to ensuring the paper is well shared. As Tim noted in his opening remarks, it was important to us as a working group that this paper does not sit on a virtual shelf and gather dust. And so to pause for a moment, I'll let you know that my colleague Andrew has enabled the chat function. And I'd love to ask each of you as participants in this webinar, if you'd be so kind to use the chat function now and share any ideas you may have for dissemination of this position paper. It may be a specific organization that you believe we should reach out to and share this work with, or you may have a general idea about a stakeholder group as well. So if you're able to, it would be most welcome if you would share your ideas in the chat now. And while you do that, I'll share our initial work to date on the dissemination strategy, which, as I mentioned, is currently in progress. So we have developed a bilingual email template to help individuals share with their network knowledge about the position paper. And so if you do have interest in accessing that email template, please do reach out. We would welcome your help to share this position paper with others. We've also begun promoting this position paper through our internal N4 channels including our N4 platform, social media, and our March newsletter. Also here at N4, we have started meeting with specific stakeholder groups to help us inform next steps for the dissemination of the paper. We have also noted that the position paper has been shared in part in newsletters outside of N4. We are taking a tiered approach. Phase 1 dissemination of this position paper is active right now, and to date meetings have taken place with Wellesley Institute and Healthcare Excellence Canada. Meetings are also being planned with the Canadian College of Healthcare Leaders, Federation of Medical Regulation Authorities, Accreditation Canada, and Healthcare Can. E-introductions are also being made to the Canadian Doctors for Medicare, Public Policy Forum, and the Alliance for Healthier Communities. We are also starting to learn more about the role provincial and federal politicians may play in phase 2 of our communication strategy. At these knowledge sharing meetings, the position paper is shared before our meeting, and then a follow-up email is sent to the meeting attendees to help them champion the dissemination of the paper. It is our hope that after you attend today's webinar, you will also help to champion the dissemination of this position paper to promote safe, equitable, and positive healthcare access and experiences for newcomers. And so before I pass it back to Mariah to lead us through the Q&A, please know I will take note of your comments in the chat for ideas to update our fluid dissemination plan. And I will also write my email address in the chat as well if you have ideas that come to mind after this webinar today.
Wonderful. Thank you so much, Michelle, for leading the group through that activity. And I can see here that there are some comments in the chat. So I know the N4 team will certainly take note of those. And thank you, Alana, for walking us through the position paper. It is truly some really phenomenal work that's been done collaboratively. And there are a lot of questions about it. So I'm just going to dive right in. We have about 8 minutes to get through some of these questions, and I'll start right at the top. So the first question is, was there anyone from Interpretation Services on the working group, or OCCI, which is the Ontario Council on Community Interpreting? Or was there anyone who had interpretation services departments in their hospital?
Yeah, absolutely. Great question. So the list of working group members is included in one of the slides here for review and in the position paper. I believe that there were some representatives from OCCI who were corresponding members of the group and kept in touch with the work. I can say I myself represent interpreter services in healthcare in Manitoba. I had another colleague here from Manitoba participating in the group. So the diversity of that group covered representation from interpreter services, also folks working within a healthcare setting, those in settlement, education, and different levels of government as well.
Thanks so much, Alana. And there's an attendee wondering how they can share this paper with their network, which is wonderful, and that's what we're hoping to achieve with today's webinar. So any ideas are welcome. Michelle, I know you spoke to this just a few moments ago. You did mention email templates. How can these be accessed?
You know, I wonder, Mariah, I'm very happy to share that template with all attendees today. If you know, I'm sure through registration details we'd be able to do that, and that way everyone would be armed with that email to use as they see best fit.
Great. We will share that email template with the participants today.
Wonderful. Thank you.
And there is another question here, and I see there's some participants who have responded to the question. So I'm actually just going to go over that. I love when that happens in our webinars, seeing people connect and problem solve. So Michelle or Alana, do you have any advice on what can be done in a small city or rural setting where there's just a major lack of interpreters?
Again, sharing from our personal experience here in Manitoba, what we've tried to do, I mean, when you think about Manitoba, Winnipeg being, you know, the capital city and one of the biggest concentrations of population in the province, that is exactly our reality here in the province, right? And so we've done our best to try to leverage the services that we've been able to establish in Winnipeg to support rural areas in our province through remote interpretation whenever possible. Dreaming big, ultimately, what I would love to see happen in the future is being able to hire interpreters locally in key areas around the province to target specific language needs. And so, you know, that's something we would love to move to in the future. But with everybody's increased comfort and access to this kind of online platform, that has certainly made remote interpreting more accessible than maybe it was 2 years ago.
Thanks, Elena. And what was the biggest lesson learned throughout as you worked with the working group?
I'm happy to share some thoughts, Elena. I'd love to hear your thoughts as well. I think our biggest lesson learned was, you know, and Tim framed it very well, was to you know, realize and accept the landscape of healthcare and settlement is very, very busy, and we wanted to ensure here at N4 that we did the heavy lifting, that we were here to help coordinate research efforts, administrative efforts, project management efforts. And so I think the biggest lesson learned was to frame it in that way, that we could do this work in a crisp way and still bring in that valued voice of all of our working group members. And so I think those lessons learned, you know, bringing the meetings down from 2 hours to 1 was important. And as Tim mentioned, you know, we're gearing up for our next set of working groups coming up in June. And so I think we'll be able to apply that lesson learned, you know, acknowledging that folks are busy, and we're here to support and do the heavy lifting.
I can add to that too, that for me, I think that the biggest realization and learning was the true value of the diverse intersectoral membership of the working group. It's so easy sometimes to get in your little silo of what you know and your specialty. And this was really an amazing opportunity to create new partnerships and learn so much from folks who have the same challenges but are working in different areas. And ultimately, the result of that collaboration has just been such a wide-reaching network. You know, I think about even all of you who are here today, you know, as we share ideas, I'm looking at the chat of ways we can share this paper. And it's because of those partnerships that we're going to have this reach ultimately to achieve our goal of sharing this information.
Absolutely. Thanks so much, Michelle and Alana, for those reflections.
Mm-hmm.
And was the BC, British Columbia, was British Columbia considered in this research, as they have a provincial model for healthcare?
Mm-hmm. I could share in terms of concrete next steps with this work. We do have a member of our N4 team that is starting to look at costing models, you know, throughout Canada, and looking at the model in BC in terms of a costing model is you know, work that she's doing, and work that we feel will be important to arm those conversations as we move to phase 2 in terms of provincial and also federal politicians to help advocate for the need for change in terms of costing models. So I appreciate that question, and an important one.
Great, thanks, Michelle. And if there is anyone today who has any information to share with us, on the final slide, there's emails for Andrew and I, and we can direct any information you have to share right to Michelle and others on the team and part of this working group. And I'm just going to move to one final question. So what are the topics for the next working groups, and how can I get involved? Love that enthusiasm.
Wonderful. So we're looking now at the topic of internationally educated healthcare practitioners and providers. I'll be leading a group specifically on the topic of rural and remote. Actually, well timed, the question that came through in terms of rural remote support for interpretation services, but I'll be looking at IHPs for rural and remote areas in Canada. And Mariah, you may want to reflect on the second working group.
And the second working group will be focused on mapping the pathways for internationally educated health professionals. So there's definitely more to come from N4 on this, and we are actively updating our newcomer navigation website. So if anyone is interested, please do go over to our website, and there's some details there about how you can become involved. So there are several questions and comments, which is really wonderful. So what we'll do is we will move this webinar, the recording and these questions, over to N4's meeting place, where Michelle and possibly the co-leads will respond directly to your questions, and everyone will be able to access those questions and responses. But before we wrap up for today, I just want to turn it back to you, Michelle and Alana. Do you have any final remarks for the audience today?
I'm so glad you asked. I just want to thank Alana and Tim for their leadership and guidance of this work. As I mentioned, we know it's busy, and being a co-lead on this work is Alana being a co-lead with Tim. It's a lot of heavy lifting, a lot of passion, and we really did enjoy the collaboration in terms of your knowledge and being a subject matter expert in this field. It's been nothing but a pleasure. It's interesting, in a virtual world, I feel quite sad for it to end in a real connection. So it's quite, like you say, it's quite incredible to have that virtual connection across the country, and it's been a real pleasure. So thank you.
Thank you, Michelle, for the kind words. As I said before, we couldn't have done any of this without all of the N4 team members who are here today and those who couldn't be present with us. The support was incredible. I think as another final reflection, I just want to turn it back to all the participants who are here today. I'm so pleased. I've been scrolling through the list of participants. I see some names that I recognize and many that I don't. And I'm actually incredibly inspired and motivated by the fact that you're all here today, because this tells me that you are interested in this work, and it just further expands our network. And so thank you for your participation, and seeing the list of participants, I think is motivating to keep the ball rolling on this really important initiative. So thank you everyone for being here today.
You're muted, Mariah.
Thank you, Andrew. Once again, thank you so much, Michelle and Alana, for being here today and presenting the phenomenal work that's been done. And also special thanks to Dr. Holland and to Kat Goodfellow, who weren't able to join, but played a significant role in this work, and all the working group members. And also to all the attendees for taking time to participate in today's discussion and share their ideas for how we can disseminate this. You're welcome to join us again for upcoming events. So there's some listed on this slide here. And if you did miss any part of today's presentation or would like to share it with your networks or team, provides a really great overview of the importance of this issue and the findings of the position paper. We will be sharing it with you, a recording, within the next week. And we will be continuing the dialogue that we've started. We are committed to continuing to share this position paper with different stakeholder groups. And we'll also move the questions over to N4's online moderated discussion forum called Meeting Place. If you're not already, we do invite you to become a member of N4. Andrew will put the details for how you can sign up to become a member of N4. And we provide regular offerings of webinars, as well as we'll be providing some details of the upcoming communities of practice that will be set to launch in the next couple of months. And following today's session, you'll also be invited to complete a survey to share your feedback with N4. These surveys help us to continuously improve and seek out new webinar content and opportunities that are responsive to topics you are interested in. And so we kindly ask that you follow the link, or when it pops up in your browser, you complete this survey. So thanks so much, everyone. We also recently launched a mobile app. So please check it out. It's available in the App Store or on Android. And thanks again for joining us, everyone. We hope you can join us again at a future event. Stay safe and be well.